Hello, I am Michael A. Grosillo and I will discuss the topic about asthma. Introduction. Studying asthma is crucial because it significantly impacts welfare, academic performance, communication, mental health, and daily life, with millions of children affected worldwide, leading to high depression rates and emergency situations. Sa totoo lang, ang asthma nito is nakaka-affect talaga ng maraming tao, especially worldwide. As a matter of fact, I am an example of this disease because I have this disease. So, asthma impacts about 300 million people globally, with prevalence increasing by 50% every decade, especially among children. So, base sa Global Burden of Asthma in PubMed, National Library of Medicine, ang mga tinatamaan nga nito is yung mga children and in 40 years sa research is approximately 300 million people worldwide ang may asthma. Imagine that. Maraming tao ang nagsasuffer sa hilang na ini, though wala pa siyang cure, but asthma has treatment pero wala siyang cure. So, babalik-balik lang sa imong hilang na ini. Kahit may treatment ka, so pag ilang weeks na naman, okay, di ka nag-treatment, babalik na naman. So, maghihirap ka na naman. Imagine that, maraming taong mga naapektuhan nito at still today, yung mga example ng mga tao na wala namang pambili is talagang magsasuffer sila sa sa disease na ito. At by the way, inherited trait. Ang asthma again is tinuturing siya na chronic inflammatory lung disease, though inherited nga siya. So, mas common siyang inaapod na disease because cause niya na pag-swell kang airways and pag narrow kang airways kang sa tong lungs, and it produces mucus leading to breathing difficulties. So, ano naman ang signs and symptoms kung meron kang asthma? So, common signs and symptoms is wheezing, whistling sound, another example naman is yung shortness of breath na parang di ka nakakangos o kang ipong nasasakitan magangos. So, next is ang chest tightness. Parang, for example, another symptoms and signs is chronic coughing. So, pag, okay, especially night. So, yan, totoo talaga is talagang banggi talaga siya na nagluluwas or kaya naman early morning. So, factors. So, ang asthma is can develop siya through two action of genetic nga, yung sinabi natin. So, genetic, pwede siya maging disorder and pwede siya maging disease. So, but mostly, generalized ang asthma as disease. So, sa risk factor is first is ang genetic factor sa family history of asthma, and next is presence of allergen atopy, and next is genetic tendency toward an overreactive immune response. Another risk factor is ang environmental factor. So, exposure to allergens like dust mites, itong mga nasa sa dust mites nga yun. Pollen, yung nasa flower, o ganyan, pag nasa ka, sa luwas, and animal dander, mold, cockroach droppings. So, udo kang mga cockroach. And another that is most common sa environmental factors is yung mga induced kang human, which is pollution, vehicle exhaust smog, and tobacco smoke, active or second-hand smoker, itong induced, yun na to. Workplace irritants like chemicals, fumes, pag nagtatrabaho ka sa laboratory or sa mga pabrika na mga nag-induce ng mga chemicals or kaya ning mga aso na pwede pwede siya maging risk factor nga sa imong sa hawak mo. And next is ang respiratory triggers, which is viral infections like common colds, flu, RSV. And next is sinusitis and weather changes. Pag nabigla ang hawak mo, biglang nag-init, biglang naglipot, pwede itong maging trigger nga. So, another risk factor sa respiratory triggers ay ang strong odors like perfumes, cleaning agents, o katong downy, mga gayan na mga kang sunrocks is talaga is real siya sa kuya as a patotoo ko nga is talaga pag napaparong ko siya parang yun lang yung mga risk factor na nagde-develop kang sa tong asthma.
Asthma comes from the Greek word for panting, which makes sense because it causes chronic inflammation of the airways, making them narrow and more difficult to breathe through. People with asthma can have asthma exacerbations or asthma attacks, which are usually triggered by something in the environment which causes immune cells to generate inflammation in the lungs, which can make them even narrower and potentially be life-threatening. So if we take a look at the lungs, you've got the trachea, which branches off into the right and left bronchi, and then continues to branch into thousands of bronchioles. In the bronchioles, you've got the lumen, the mucosa, which includes the inner lining of epithelial cells, as well as the lamina propria, and the submucosa, which is where the smooth muscle lives. The molecular pathway that leads to asthma is actually pretty complex, but it's often initiated by an environmental trigger. In asthma, there's often an excessive reaction from type 2 helper cells, or Th2 cells, against specific allergens. Th2 cells are an immune cell subtype, which are known to be involved in asthma, as well as atopic dermatitis and allergic rhinitis, making up what's called the atopic triad. What can happen with asthma is allergens from environmental triggers, like cigarette smoke, are picked up by dendritic cells, which present them to Th2 cells, which produce cytokines like interleukin 4 and interleukin 5, leading to a number of the features of asthma. For example, interleukin 4 leads to the production of IgE antibodies, which coat mast cells and stimulates them to release granules containing things like histamines, leukotrienes, and prostaglandins. Interleukin 5, on the other hand, activates eosinophils, which promote an immune response by releasing more cytokines and leukotrienes. In this case, since IgE antibodies are being produced, this is an example of a type 1 hypersensitivity reaction. This leads to two series of events. Early on, minutes after exposure to the allergen, smooth muscle around the bronchioles start to spasm, and there's increased mucus secretion. This narrows the airways, making it difficult to breathe, and this is why asthma is considered to be a type of obstructive pulmonary disease. There's also an increase in vascular permeability and recruitment of additional immune cells from the blood. These immune cells, especially eosinophils, release chemical mediators that physically damage the endothelium of the lungs. Initially, these inflammatory changes are completely reversible, but over the years, irreversible changes start to take place. Edema, scarring, and fibrosis build up, leading to thickening of the epithelial basement membrane, which permanently reduces the airway diameter. Although the specific causes of asthma are ultimately unknown, it's thought to be caused by a combination of genetic and environmental factors, since certain genes have been identified that increase the risk of developing asthma, and having a family history of asthma seems to increase the risk as well. For environmental factors, there's the hygiene hypothesis, which suggests that reduced early immune system exposure to bacteria and viruses might actually increase the risk of later developing asthma, possibly by altering the overall proportion of immune cell subtypes. In general, causes of childhood asthma diagnosed before age 12 are thought to be due to a stronger genetic influence, whereas later onset asthma is more likely to be due to environmental factors. Now, the triggering substance that leads to an asthma attack can differ from person to person, but some common ones include air pollution like cigarette smoke and car exhaust, as well as allergens like dust, pet dander, cockroaches, and mold. Medications like aspirin and beta blockers have also been known to trigger symptoms in some individuals with asthma. That said, symptoms of asthma include coughing, a feeling of chest tightness, dyspnea or difficulty breathing, and wheezing, or a high pitched whistling sound that usually happens during exhalation. Occasionally in the sputum, there might be Kirschmann spirals, which are spiral shaped mucus plugs or basically elongated mucus casts from the small bronchi of people with bronchial asthma. Mucus plugs can be particularly dangerous because they not only block exchange of air, but they also block inhaled medications from getting to the site of inflammation. The mucus might also have Charcot-Leyden crystals, which are shaped like needles and are formed by the breakdown of eosinophils. Now, asthma can be classified according to the frequency of symptoms, in particular nighttime and early morning symptoms, the FEV1 or forced expiratory volume in 1 second, the PEFR or peak expiratory flow rates, both of which measure the amount of obstruction in the airways, and finally how often a person is using asthma medication to help with the symptoms. From least to most severe, the types of asthma are intermittent asthma, mild persistent asthma, moderate persistent asthma, and finally severe persistent asthma. While there's no cure for asthma, there are treatments available that can help manage the symptoms and prevent the development of an asthma attack. First, people with asthma should avoid or minimize contact with triggering substances by vacuuming, removing carpets and rugs, and changing the environmental conditions, like for example drying out a room in the case of molds that grow well in moist areas. There are also a number of medications that can reduce the symptoms of asthma. Bronchodilators like short-acting beta-adrenoceptor agonists and anticholinergic medications are often administered through emergency inhalers. These fast-acting medications cause the smooth muscles in the lungs to relax and therefore dilate the airways, opening them up so that the person can breathe. Individuals with more severe forms of asthma might need additional treatments, like daily corticosteroids, long-acting beta-adrenoceptor agonists, or leukotriene antagonists. In very severe cases, intravenous corticosteroids, magnesium sulfate, and oxygen therapy might be needed. Alright, as a quick recap, asthma is characterized by chronic inflammation in the lungs, as well as asthma exacerbations or attacks, where certain triggers start up more inflammation, which leads to smooth muscle spasms and mucus production, both of which make it hard to breathe.
Harry? Okay, Harry, stay there, stay there.
When a child has an asthma attack, the muscles in their airways narrow, making it difficult for them to breathe in and out. Using an inhaler relaxes the muscles, allowing their air passages to expand and ease their breathing.
That's all right, that's all right.
Diagnostic and medical test on asthma. So how do doctors assess them? So doctors assess symptoms like wheezing, coughing, shortness of breath, and chest tightness, often worsened by triggers such as allergens or exercise. So in initial assessment, medical history reviews symptoms, family history, and triggers, while a physical exam checks airways, skin for allergies, and breathing sounds. Using a stethoscope, pulse oximetry measures blood oxygen levels, and imaging like chest x-rays rules out other conditions. In short, sa initial assessment, yan yung mga ginagamit para matest. So in lung function test, spirometry is used as a primary test measuring on how much air you exhale and how quickly after a deep breath. Detecting airway narrowing peak, flow meters track daily airflow. To monitor variability and phenotest, detect airways also if there's an inflammation via exhaled nitric oxide. So in treatment and management, dito na papasok yung mga ginagamit like therapy, mga inhalers o mga salbutamol for nebulizers, painkillers, mga pang-ease para mag-relax yung lungs.